He's Lachlag. He's Huiswe Nikki Petrie. He's Jintes Huiswe Huele. Chinstitz Usmium. Hello, everyone. I greet you with a happy heart and a warm handshake. My given name is Nikki Petrie, and my Indian name is Huele, which means meadowlark. In our ways, meadowlarks bring good medicine, and I hope to bring that to you today. I work for an organization called the Center for Native American Youth, which is a policy program at the Aspen Institute. We work very hard to make sure that Native youth are supported, empowered, and loved every day. It's a real honor to partner with the Aspen Institute's Global Innovators Group on this discussion of how COVID-19 has been impacting Indian country. This is the second live Aspen Health for All conversation, which was launched to amplify the work being done by leaders and innovators around the world to address the disparities that have been amplified by COVID-19. We have a panel of individuals doing remarkable work for our country. I'm joined here with Dr. Eric Brodt, a family physician working to improve Native American outcomes based at Oregon Health and Science University, Emma Robbins, a Dene artist, social justice fighter, and 2020 Healthy Communities Fellow working to secure access to safe drinking water on the Navajo Nation. And I especially want to acknowledge my CTA, my little sister, Shavana Underwood, who is a 2020 Champion for Change at the Center for Native American Youth, and a young leader who specializes in spiritual healing for Indigenous people. I'll be asking questions and inviting our panelists to share their work and their recommendations, and if time permits at the end, we'll open it up for question and answer. At this time, I'd like to invite our panelists to introduce themselves.
Good morning, I'll start. Thank you for that introduction, Nikki, and I'm very honored to be here with everybody, but especially the two other panelists who are amazing. Yat Eshe Emma Robbins, Yanashia, Bilagana Nishle, Hashkan Hadzoke Bashichin, Bilagana Dashiche, Adona Kaidene Dashinale, Akot Ego Stana Nishle. My name is Emma Robbins, and I am the director of the Navajo Water Project.
Ni buju gakina wia nangejnika ganuan on the way nini nindo dem wabjeshi ninishnabe. So good morning, everybody. Greetings, my relatives. My Christian name is Eric, and I'm Ojibwe or Anishinaabe, and my Ojibwe name is Brown Eagle, one who brings healing to people, and I'm from the Pine Marten clan. So good morning, everybody. Great to be here today.
On Chuck Felice Masham, on Chuck Shavana Underwood, Hinch Queen Out. Good day, everybody. My name is Shavana Underwood. My ancestral name is Elise Masham. I come from the Quinault people. I am the vice president of the Quinault Culture Committee, the secretary of the Quinault Canoe Society, and I'm a behavioral health administrative assistant here at our Roger Fox Health Center. And I'm also a student at Evergreen State College, and I'm a 2020 Champion for Change. I'm happy to be here today and talking to you.
Thank you so much. So my first question is going to be for Dr. Brodt. Native Americans are susceptible to the coronavirus because of the disproportionate rates of asthma, heart disease, hypertension, diabetes, and other pre-existing conditions. Additionally, many tribal communities and tribal members live in close proximity and have intergenerational homes. Can you share a broader overview of how COVID-19 is impacting Indian communities, including tribal, reservation, and urban areas?
Yeah, thanks. Good morning. I think the simplest way to look at what is happening right now is that it's a crisis on top of a crisis. So what the COVID-19 pandemic is doing is it's drawing back the shade of health inequities that we are experiencing and have been experiencing for some time that aren't just a year or so in the making, they're actually decades in the making. So the Indian health service system, or the Indian health system, is comprised of three main entities, one being the Indian Health Service through direct care, two being tribal health services, which are administered by tribes, usually with funding from both the Indian Health Service and their own economic enterprises, and then the third being urban Indian health clinics and facilities. So what we are experiencing right now is that we are in a circumstance where, like you said, tribal communities are disproportionately affected by the coexisting conditions, which unfortunately are correlated most with increased morbidity, i.e. poor outcomes, and then increased mortality, i.e. death. And so what the COVID-19 pandemic is doing is it's actually a circumstance which has the potential to impact tribal communities, tribes across the country gravely. So that is the circumstance that we exist in right now. And just to give you a little bit more background, I work in 2 locations. One, I'm an inpatient provider at a large quaternary university hospital here in Portland, Oregon, called Oregon Health and Science University. But I also care for patients in a tribal health system at a reservation in Central Oregon. So having that perspective and that contrast of one system that is stretched by this, but has resources, and then the other system which was already stretched, already in crisis, already with provider vacancies and decreased resources, and then has to confront and respond to a pandemic. So that's the perspective I come from today.
Thank you so much. My next question is for Shavana. Shavana, you've been delivering fresh fish to elders in the Quinault community to make sure that our elders are taken care of. Can you share a little bit more about the importance of caring for your community, especially the importance in caring for our elderly?
Absolutely. So even in a pandemic, we have to take care of our elders, but we have to do that in new ways and safer ways. So I don't actually go inside. I have a designated drop-off area, and I don't do that as often as our employees who make over 100 meals Monday through Thursday and deliver every day so that our elders are not without food. So they do that safely with gloves and a mask, and they deliver the prepared food. And working in behavioral health, we just want to make sure people aren't lonely. So we make virtual sessions, phone call sessions, because ultimately isolation is not natural. So human beings are social beings, and we want to make sure that they have that social interaction in the safest way possible. And in my notes from our elders program, we provide stipends to local groceries so that people don't leave town, because we want to encourage elders to stay home and to shop locally. And we pick up their medication from the pharmacy and deliver it, so they don't have to come to our health clinic. That's a major health hazard. And my last note is just helping with loneliness and providing activities that they can do within the home, or come to our local gardening at a safe designated time to come get fresh vegetables and fruits. And so those are some of the things that our community is doing for our elders here.
Thank you very much, Shavana. Your work is absolutely amazing and inspiring and reminds us to be a good relative. Emma, approximately 33% of the Navajo Nation does not have access to running water. And for context for the participants, the Navajo Nation is roughly the size of West Virginia. 6 years ago, the Navajo Nation, or the Navajo Water Project was created. Can you share with us about the services you provide to the Navajo community?
Yeah, thank you for that question. So definitely our work has shifted in the past couple of weeks. I'll explain what we did prior to COVID-19 and what we're doing now. The Navajo Water Project, as you mentioned, was started 6 years ago, and we work throughout the nation. Again, as you said, if we were a state, we'd be the 10th largest, equal to West Virginia. And what we do are long-term water access projects. So that ranges from installing cistern systems for families that are living off-grid. That includes an underground cistern that relies on a water delivery truck that brings safe potable water. On the reservation, water sources aren't always safe because oftentimes there is uranium contamination or arsenic contamination. And we bring safe water to these homes. There's a series of plumbing and a sink, and I won't go into all of that, but at the end of it, hot and cold running water is provided to families. And now what we've shifted to doing is a lot of relief and mutual aid work. That definitely happened overnight, but we still are fulfilling our mission of getting families potable or drinking water. That is now through deliveries of bottled water, and we are working outside of the areas that we usually work in and across the Navajo Nation. My next hope is when COVID lifts, we've been planning to start implementing sanitation, so indoor plumbing, but including bathrooms and septic systems, because people often forget that when you don't have running water, you don't have bathrooms, and that's equally important.
Thank you so much for your work. Dr. Brodt, in your opinion, what is the primary solution you see eliminating health inequities and structural barriers in Indian country?
The other hat that I wear at Oregon Health and Science University is the director of the Northwest Native American Center of Excellence. And what we do is we train American Indian Alaska Natives to be our future health leaders of tomorrow. So simply put, to me, I think one of the key solutions to the health inequities and imbalances that we experience as tribes, as tribal people, is our youth. You know, I think that there's a lot of people that might look at some of us who are on the screen today and say, oh, you guys, you're unicorns, you're super special. You know, you were like the one who could make a difference. And I don't believe that at all. Where I grew up, there's 100 people like me. It's just maybe they didn't have the exact same opportunities, or there wasn't someone who kind of showed them along the path to this type of career. And so what we do is we train American Indian Alaska Natives who want to be health professionals to do exactly that. So right now at OHSU, we have a number of American Indian Alaska Natives that we're training to become physicians through some unique programs that we have. And what's really exciting about that is not only when a Native person goes back and lives and works either near in their community, do they provide health services? Do they reduce, you know, these abysmal access to care issues due to provider vacancies? We create jobs when we go back. And so each one of us that enters a community as a full spectrum provider creates almost 26 new jobs in a community. And so when you're looking at communities that are struck by higher rates of unemployment and poverty, infrastructure issues like Emma was talking about with water, having people who are American Alaska Native, our youth, training them to be the solution that we need is the direction I take and I go in. Great question, thanks.
Yeah, it's times like this where we definitely need to look and rely on the next generation to kind of pave this way for us. Thank you very much for that response. Shavana, we have seen tribal nations from across the country close the reservations and lands to outsiders exercising tribal sovereignty to ensure safety for community members. Tribal councils and tribal governments have created ordinances and curfews for tribal members to abide by. This includes canceling a lot of community gatherings, ceremonies, and other cultural happenings, which have weighed heavy on mental health and the kind of mental health of our people. What guidance can you give in navigating social distancing and still ensuring that we are leaning into our culture and tradition?
I love that question. So I just like to note that there are over 560 plus tribal nations. So we're all really different, but I want to get the point across that I say all the time, that your culture is your identity and no one can take it away from you, not even a pandemic. So it's still there and no one can take it from you. You have to practice it in more safer ways. And our ceremonies will be there waiting for us when this blows over, when we get through this. And right now we just have to normalize this new reality, hold on to our spirituality stronger than ever, and understand that staying away is hard, but it's the safest thing for all of us right now.
That is so beautifully put. Thank you so much, Shavana. So before we go to my next question to Emma, I wanted to remind the audience that you can use the Q&A section at the bottom of your screen for any questions that you might have for Emma, Dr. Brodt, or Shavana. Okay, so my next question is for Emma. Since time immemorial, it is women who have been the caretakers of our community, protectors of our people, and the real backbone of our society. What does it mean to you as an Indigenous woman coming from a matriarchal society to be able to provide water for your people?
Yeah, so I think first and foremost, I want to give a shout out to other Indigenous women, included Nikki and Siobhan on this call, because during this time, so many Native women have stood up and like you said, always we've stood up for our communities. And I get to work with such an amazing group of really great Navajo and other Indigenous women. And it's amazing. It's been an example for myself. I think I've always been set on that path by my mom, by my aunties, by my grandmother. And it's something where I think it is our duty. And it's something that doesn't mean because we're helping our communities as women that we're stuck in the kitchen and it's this idea of the 60s. That's not it at all. We're leaders and we are used to doing this, right? We've been doing this for many centuries, over 500 centuries in terms of the arrival of colonizers and whatnot. So whether it's a pandemic or bringing running water to families, it's something that I'm very fortunate to do. I'm the oldest of 3 girls, and so I'm really bossy, and that helps me a lot in my job because you got to get it done. Working on a Native nation is very different than working with contractors who might think that I don't know a lot about plumbing, or my female colleagues don't know a lot about plumbing. So I'm very blessed to be able to do it. And I think, again, I just really want to acknowledge my other Indigenous sisters who are doing things right now or every day, whether that ranges from staying home or to going out and delivering water. But again, I'm just so fortunate to work with such an amazing group of people.
Wonderful. Thank you very much. So my next question is for any of you. In what ways can those of us who are participating in this webinar support your work?
Well, I think that the biggest challenge that we're going to face, kind of looking forward, speaking from the Center of Excellence at OHSU, there's going to be a shift in how federal dollars are going to be allocated probably over the next few years. We're probably going to be subject to budget cuts. I think that as our Center of Excellence is funded both by federal, state, and philanthropic gifts from tribes in the area, the reality is that access to resources to continue our programs is really fragile right now. And I can foresee a significant shortfall in all 3 of those arms that I just mentioned. And so if there is somebody on this call or has friends who are participating or that you know of who want to support training the Native health leaders of tomorrow, we will need help to make that a reality. And so donations through the OHSU Foundation would be very much appreciated, because we need to keep this work going. A pandemic is laying bare the inequities that we experience, and the response may result in us not being able to continue our work, which would leave us in even more troubling circumstances. So if there are people who want to join us in this effort to support American and Alaska Natives to become health professionals, please get in contact with me and we can dreamstorm together on how to make a difference.
Anna or Shabana, do you want to share about how people can be supportive of your work?
Yeah, I'll go next. So I would encourage everybody to visit our website, which is navajowaterproject.org. I know some people still spell Navajo really old school with an H, but it's a J. So Navajo with a J, waterproject.org. I think it's really important to say that not only can you see the work that we do or make donations that would help during the pandemic, or like I said, to our septic programs or other long-term access projects, but also you can go to our website to educate yourself about the water situation on the Navajo Nation. We have some really great links up right now about how to assist during the pandemic. And again, I think once you are able to arm yourself with that knowledge, it's not just about keeping that and saying, great, I learned about statistics of how many Navajos or other Native nations don't have running water. It's more about arming yourself with knowledge so that you can share that information with others. Because once you're able to do that research, and even it's just in the back of your pocket, that's really important, because it's not just about donations, it's also about education and sharing that information. So again, NavajoWaterProject.org.
Thank you. Shavana, I wanted to give you a chance before I move on to the next question to respond if you wanted to.
I don't have anything specific to donate to. I just always like to say, be uplifting to Indigenous voices, know your own stolen land, and yeah, be uplifting to the Indigenous voices around you.
Thank you very much. So we do have a couple questions from the audience. The first one being, how are you seeing testing being important in control of COVID in Native communities? We're seeing IHS lacking testing capacity, despite promises of testing machines, etc.
I can take that question. That is true. We do not have the access that is being touted. And there's actually the scarcity of the testing within Indian Health Service and tribal health system clinics and facilities. It's surprising and appalling to me, especially in Oregon, where the third case of COVID in Oregon was in a county which is 3.5 hours away from an urban area, which is the home to one of the main tribal communities here. And so we absolutely need more testing and more transparency from our federal leaders regarding that.
Thank you, Dr. Brodt. Let's see here. So this next question is all for any of you. Congress has passed the Coronavirus Aid, Relief, and Economic Security Act, which is the CARES Act, included $8 billion for tribes with the $150 billion Corona Relief Fund. How can we support you all to ensure that these dollars are released equitably and in a timely manner, and ensure that it lands in the hands of Indigenous people and systems?
I can start off by saying, it's important that, one, we recognize that we're sovereign nations and that we are able to solve our own problems and we are able to get in there and react. However, we're able to do that when we get aid from the federal government, right? And hold them accountable for these treaties that have been signed and say, this is where we come together, this is how you support us, and this is how we act on it. We definitely, people who live in the United States, we need to hold our government accountable. And I would say, make sure to contact your officials, and say, this is where the money needs to go to. These are the Native nations that need assistance, because we won't get that unless we hold our elected officials accountable. And I think, again, in terms of education, it's really important to share that information and say, this is what can be done with your social media or your family or your friends, because again, being sovereign nations, we're able to help ourselves, but we need to work together with governments, whether it's tribal, federal, local, to make that happen.
Thanks, Emma. So it may be hard for listeners to understand the true impact of the lack of water for Indigenous families. Emma, can you share with us a little bit about a typical household or community, what lack of water means for everyday life, and also your impact within your organization? Do you have maybe any data or statistics about the amount of water that you've been able to bring into the community?
Yeah, I mean, it is an amazing luxury to have running water and indoor plumbing. I was very fortunate to grow up with running water myself on the reservation. I'm from one of the largest communities there. And so we do have infrastructure, but 30 miles away where my Nullies, where my grandparents were living, they did not have running water. And on the weekends I would spend time with them. So I definitely saw the duality of what it's like to have the luxury and what it's like to not have that. You know, it's not just about being able to turn on the tap to get drinking water. It's also about being able to wash your hands, obviously, as we're seeing now. It's about being able to brush your teeth and clean yourself and feel, for lack of a better way to say it, like everybody else, right? If you're going to school and you went with students who were able to take showers that morning, but you weren't able to, or your clothes aren't as clean, that impacts you mentally. It's not just about having running water to make things happen, like I mentioned, but it's just to elevate the way that you feel. It's difficult because we're often rationing water on the Navajo Nation, those who don't have it. And so you're not staying healthy because you're not consuming what you should consume. As you mentioned, there are at least 33% of Navajos living without running water. I'll also mention that there are almost 2 million Americans throughout the United States that don't have running water either. And so it's just a reality for so many people to say, well, you know, this is something that will eventually be solved. No, it has to be solved now. This isn't something that can wait. It's not like, oh, I didn't have electricity or my water was turned off for a few hours because whatever utility company was working on it. It's something that definitely needs to be solved. And there are ways to bring it to people who still want to live traditionally and live off grid on the Navajo Nation and maintain their crops and their sheep and our culture in that way. We can bring water to those areas. Obviously, being hooked up to a main water line is ideal, but not everybody wants to move to a larger town like where I grew up. And I think it's something where we have served on the Navajo Water Project almost 300 homes to bring running water. And in one day, you do see that difference when somebody is not having access to a sink, and then a few hours later, we've installed a sink. I also think one thing that's really important to mention when solving these really difficult issues, like not having running water, is working with the community and not coming in and saying, these are copy and paste solutions. What might work on Lakota reservations are going to work on the Navajo Nation. It's about meeting with the people and solving those problems and saying, this is what's going to work for you. How do we make that happen? And I think, again, it's just really about realizing that as Native peoples, we need to be elevated and we need to be on the same level as everybody else. And that includes having running water.
Just to build off of what Emma is saying there, before COVID-19, before the pandemic happened, at the tribal clinic that I work at, we had a period of weeks this past summer where between patients, we had to go out to the parking lot to wash our hands because we did not have running water in the community or the clinic due to like really outdated infrastructure. And so we did not have access pre-pandemic to an adequate infrastructure to be able to have safe, clean, running water to even wash our hands between patients. So it's not, it's an issue that rings true kind of across the country for this. The infrastructure needs to change. We need help with that.
Yeah, and oh, I was just going to say, just really quickly, Dr. Brote, you bring up a good point because it's not just about having running water, it's about having updated infrastructure where we don't see schools like special needs schools that I've worked with on the reservation where they're having leached lead and copper in their water, because these are populations, if you're working in a hospital or if you're working in a special needs school, there are already so many problem solving issues going on. So why is it that there isn't running water that's clean there? So I totally agree with you. It's not just about lack of running water, but it's also making sure that we have access to updated plumbing systems.
Thank you all so much. And thank you everybody for participating in today's webinar. We'll be sharing resources as well as ways to support these amazing leaders. Dr. Brote, Emma, Shavana, thank you so much for sharing your knowledge with us. We hope you'll consider taking action to support the important work of these leaders and others throughout the country. Check out their websites listed and learn how else to get involved in tomorrow's Aspen Health for All newsletter. We invite you to join in future conversations and stay involved by using the hashtag #AspenHealthForAll on social media. If you have any additional questions for myself or the panelists today, please feel free to email cnayinfo@aspeninstitute.org. It is my hope that as Indigenous people, we will continue to turn to our culture and carry us through this time. And to the participants, please remember the resiliency of Indigenous people. Liim Lynch and Jespa Us, a heartfelt thank you.